So I'm Dr. Megan Poor. I was asked to give this talk really just kind of hitting on the health needs of our community. And so the initial part here is going to go through a survey community health needs assessment that was completed in 2016. And then the second part will be talking more about community vaccination rates and why that's important for the health of our entire community. And so the community health needs assessment was completed in 2016. This was a survey that was sent out to 2,500 households in Mercer County. They had about a 20% response rate, so 492 residents completed the survey. We're going to work through some of these topics that were covered on the survey itself. Just looking at the respondents, so a pretty fair breakdown across the age groups, income levels, education levels. I will point out that only, so of the surveys, 69% had no children living in the home, 21% had 1 to 2 children, and then 10% had 3 or more. So the first topic was healthcare indicators. And so these are various things that can kind of indicate, you know, are those patients in the community able to access healthcare when they need it? And so one indicator of that is health insurance. So what percentage of the population has health insurance? That is one area where we are doing well, so above the Ohio and then United States levels. So we have 92% of residents with health insurance. The breakdown there is 79% private and then 27% public, being Medicare or Medicaid. Another important indicator for healthcare access is, well, how many doctors and providers are available so that when you need to be seen, you're able to be seen. This is certainly one area where we fall behind. So this is the information from the survey assessment. And so for Mercer County, we have 1 physician for every 833 people in the community, whereas Ohio on a whole is 1 to every 250. Now that's looking at physicians as a whole, and so that would also include specialists and subspecialists who are going to be obviously more highly populated in a city than out in a rural area. So this was pulled from a different county health rankings assessment over here, which shows the primary care providers, which I think is a better reflection of where we stand. Again, though, still lacking there. So Mercer County, 1 primary care provider for every 2,270 patients, whereas Ohio is 1 to every 1,300 patients. So we're still about half the amount of providers, comparatively speaking, for the rest of the state. And then when we look at mental health providers, I think this is an area where we obviously see a big need. So that would be counselors, therapists. Mercer County has only 1 counselor for every 1,240 people in the population, whereas Ohio on a whole is 1 to every 310. And even Ohio and the nation, everybody talks about how there aren't enough counselors and there's not enough access to good counseling, but we obviously feel that way more so in our area, and certainly as an outpatient provider, that's something that I see every day. It's just really hard to get patients adequate counseling when they need it. They looked at various behavioral risk factors, the key findings there being 40% of respondents had reported binge drinking, and then there was also over a third who were considered obese. So binge drinking, the definition here is 5 or more drinks on one occasion in the past month for men, 4 or more drinks on one occasion in the past month for women. And so certainly that was well above the Ohio numbers. When we look at obesity, adults, we have 38% of patients would be considered obese, so that's a BMI greater than 29.9. For children, obesity is based on a BMI percentile, but for children in 2016, based on this study, there was about 10% in our county who were considered obese. Some indicators of preventative healthcare and how we're doing. These numbers I think are a little hard to interpret, so partly because the guidelines continue to evolve and change, and even during the time that the assessment was done, there was fluctuation there with the recommendations. But cervical cancer screening, they defined as a pap smear within the past 3 years. So 77% of respondents were up to date on that. Breast cancer screening was a mammogram within the past 2 years for women ages 40 and over, and we had 70% there. Now, I find those numbers hard because Those recommendations for pap smears, it's now every 3 to 5 years really, depending on the testing and the age category for the patient. The mammogram screening keeps changing too, so a lot of people no longer recommend mammograms for women in their 40s. It's really women between ages 50 and 75 that certainly we have the best data for mammograms. And so again, that data gets a little bit hard to interpret there for those other age groups. Prostate screening, this has also very much changed. So the recommendation now is to have a conversation with your patients between 50 and 75 with men about prostate screening and whether they want to do it or not. It's not an automatic screening that everybody needs to do by any means. And then colon cancer screening is one that was not included in the survey, but really this cancer screening that I find the most important because we really have such great data that it does save lives and prevent colon cancer. So this is a number that I just had pulled from Epic, which is our electronic health record system. This number showed that only 32% of adults between ages 50 and 75 are up to date with their colon cancer screening, which is terrible. But I don't think that our true numbers are that bad. So that is data that was correctly entered in the health maintenance tab of Epic. So if you didn't click all the right boxes, then it's not going to show appropriately. So I think we're higher than that, but I still think we clearly have a lot of work to do in that area as well. And then next section here, looking at maternal and child health. So the infant mortality, we had one that was reported, but the numbers were just so low that we couldn't really glean anything there. Looking at teen pregnancies, Mercer County was lower than the Ohio and United States average for those early teenagers, but then for the 18 to 19-year-olds, we were certainly higher. And then for the birth weight, that's an area where we really did quite well. So only 3.6% of babies born were considered to be low birth weight, whereas Ohio has 8.5%. So shifting gears, that was really all that I wanted to cover from the health needs assessment. So now we're going to talk a little bit more about vaccines and immunization rates and why that affects everybody in the community. So to understand where we're coming from here, we first have to talk about herd immunity and what that means. So looking at this infographic, which comes from the CDC, the top picture here is a population where nobody is immunized. So the little blue people are healthy, but they're not immunized. And then the red people are two people who happen to get the disease. So we're going to talk about measles. So we'll say these two have measles. If nobody's immunized, then pretty much everybody gets measles. The middle one here is where some of the population is immunized, but not enough to get that herd immunity. And so again, if a couple people get measles, it really spreads pretty widespread to all of those who are unimmunized. It's really just those people who are immunized who are protected. Whereas the bottom here is truly herd immunity, and this is what we're after. And so typically this occurs when you have about 93 to 95% of people who are immunized. And so in this situation, we have one or two people who get measles, but then everybody who comes in contact with them, everybody who really surrounds them in the community is vaccinated. And so then the disease stops there, and it's only those one or two people who get measles, and it doesn't spread to others in the community. The important piece too here is to keep in mind that some of these blue people who are healthy but not immunized, they're not immunized because they can't be immunized. And so the MMR vaccine, for example, we don't give that to infants under 12 months of age. It's not recommended. It's not recommended for people with a suppressed immune system. And so I circled this blue person as an example. So this is maybe an infant. So it's an infant who's healthy but not immunized because they can't be immunized yet. So, when we only have part of the population vaccinated, that infant is still really going to be high risk for contracting the disease. Whereas if we have herd immunity, then that infant is protected because all of those around them are immunized, and so then they're not going to contract the disease. So thinking about our current measles outbreak, so this is as of June 20th, 2019. Measles has been reported in 28 states. Ohio, thankfully, is not one of those. So the dark blue are the states where it has been reported. So none in Ohio, but obviously in all of the states surrounding Ohio. When we think about what is measles, typical symptoms would be a high fever, 104, 105, plus the 3 C's, which is cough, coryza, which is a fancy word for runny nose, and then conjunctivitis, which is red and inflamed eyes. So you get those 3 C's and the high fever first, and then 3 to 5 days later is when the rash shows up. And so it's just kind of spreads head to toe all over rash. The important thing to keep in mind is that, so these kids, in the beginning, fever and a cough and a runny nose, they look like every other kid with a viral infection. And so it's hard to really know that it's measles until that rash shows up 3 to 5 days later. Oh, and they're contagious for a day or two before they even get symptoms. And so by the time that these kids are diagnosed, oftentimes we've had a widespread exposure to a lot of people. And it's really contagious, which is another big part of measles. So if we have 10 people in a room who are not immunized to measles, then 9 of them are going to contract the illness. It's also airborne, and so it gets really hard to control. So if we have somebody with measles in this room and they cough and then they leave and they walk down the hall, well, measles is going to stay in this room for 2 hours afterwards. And so even if the patient is not in the same room as you, you can still contract measles. And that's part of why it just spreads like crazy if the population is not fully vaccinated. And so for a lot of patients, it's this 7 to 10 days of illness. But for some patients, certainly we see complications from measles as well. And this is really the part that we worry about and that we want to avoid. So 1 out of 4 patients who gets measles will be hospitalized. And 1 out of 1,000 will develop encephalitis, which is infection of the brain or the spinal cord, the linings of the brain and spinal cord. Encephalitis can then lead to really bad lifelong neurological deficits. Pneumonia is the #1 cause of pediatric measles-related cases. And prior to the vaccine, about 500 people died every year, and about 1,000 people were permanently disabled every year from measles. And I've had several patients ask me like, oh, well now, even if we get measles, it's going to be better because that was back in the 1950s, right? Wrong, because it's still a virus and we don't have any great way of treating people. It's still supportive care. And so really not a lot has changed from that standpoint. The good news here, though, being that the vaccine, thankfully, is very effective and it's very good. So with the recommended dosage, the first dose of the vaccine is at 12 months of age. That gets about 93% immunity. Kids then get a second booster at 4 to 6 years of age, which increases that to about 97% of kids will be then protected. And that lasts for your whole life. So if you were vaccinated for measles as a child, you're good. You don't need any more boosters. You are protected for the rest of your life because it's very effective. So this is just kind of coming back to the current outbreak. You can see, normally there's a few little pockets of measles. Those are mostly due to people who travel abroad. They get measles, they bring it back, and then we have a few little sporadic cases. But obviously we've had way more this year in 2019. So that's just for the first 6 months. We've had 1,077 cases. So if we double that for the next 6 months of the year, we can project maybe about 2,000 cases of measles this year. I will just point out, because I find it interesting, this other little spike here in 2014 was because they had measles in Amish population in Ohio. And so kind of the Northeast Amish population had measles. They were all unimmunized, and so it spread like crazy, and 383 people in that community had measles during that time period. So when we look at our county vaccination rates, they're pretty terrible. And so that is why, really the Ohio Department of Health is trying to get everybody vaccinated. And it's those communities who have low vaccination rates who are certainly higher risk for a potential outbreak. So when we look at counties in Ohio with the highest exemption rates, so this means we're looking at kindergartners. Of the kindergartners who are not fully vaccinated, the counties with the worst rates basically. So #1 is Holmes County, which is over in Northeast Ohio. And then you can see 2 and 3, Auglaize and Shelby County, which would be our neighbors. And then Mercer County is #4 with 7% of children who are not fully vaccinated. When we specifically look at MMR, the kindergarten completion rates, Mercer County as a whole is 89.5%, which of course is below that 93 to 95% that we really need for herd immunity to protect those in our community. When we look specifically by school district, these numbers were published in the Standard last week. So of the kindergartner MMR rates, Fort Recovery and St. Henry being the worst at 85%. And just a few of our school districts who are going to be above that 93 to 95% to be protected in an outbreak setting. And so the big push here being, get your vaccines, encourage others to get their vaccines as well to protect all of us. So who should be vaccinated? We kind of touched on this. So kids routinely at 12 months of age, and then again that booster at 4 to 6 years of age before entering kindergarten. Adults should be vaccinated if they do not already have presumed immunity. So presumed immunity, we just assume that you are immune if you were born before 1957, because prior to that date, measles was so widespread that pretty much everybody just got it. So you probably just had the illness as a child, in which case you're immune for life. If you are high risk, you need 2 doses of MMR, so that would be college students, people who travel abroad, and healthcare workers. Otherwise, if you are not high risk, then 1 dose is really felt to be adequate, because even just with 1 dose of MMR, you get 93% immunity. And then if you do not already have lab evidence of immunity or disease, so if for some reason you had titers drawn and it was shown that you're immune, then you're good for life as well. There is this little caveat. So some adults, felt to be about 5% of the population, received the MMR vaccine between the years 1963 and 1967. At that time, they were actually doing a killed virus, and it was found to then not be effective. So if anybody falls in that category, then it still would be recommended that they get the current MMR vaccine. And then also important for anybody traveling abroad, because historically that's how most of our outbreaks start. Measles is still very much a problem in many areas of the world, and so a lot of measles outbreaks start with somebody who's unvaccinated, travels abroad, gets measles, comes back, and then shares it with others. And so important for travelers to be up to date on that. And with that in mind, the MMR, in general, 12 months of age for that first vaccine, but infants as young as 6 months of age can get the MMR vaccine if they're going to be traveling abroad or if they are in a current area of outbreak. The contraindications for vaccine, it is a live attenuated vaccine, meaning that it is a very much weakened version of the live virus that we presented to your body, and then your immune system learns how to recognize it and how to fight it off. But because of that, it is not to be given to anybody with a suppressed immune system, also not for pregnant women or, again, young infants. This is just my personal take on kind of what I hear. So, we talked about vaccine is so safe, it's so effective. Well, why are patients declining it? The things that I just happen to hear most often in the office are certainly safety concerns. So parents who are worried about, well, what's in the vaccine? Is it safe? Is it going to cause any long-term problems or complications for my child? I really think that we can wholeheartedly say it is very safe. We do not need to worry about any of those. There was, in the 1990s, there was this false report of maybe a link between the MMR and autism. That has been proven to be absolutely no link whatsoever, time and time and time again. So that has been completely debunked. Sometimes they worry about the preservatives and the things that are in the vaccines. Certainly there are preservatives in the vaccines. That's how we're able to keep it on the shelf before we inject it into the patient. But again, those have all been very well studied and have certainly been proven to be safe as well. So all vaccines go through rigorous testing with the FDA before they ever make it to the population as a whole. False information from the internet, I have heard more times than I can count. Declining vaccines, oh, well, why are you declining? Because of something I read on Facebook, and I crumble inside. And so I think, making sure that we're directing patients to good resources with reliable information so that they can make their decisions. And then I think another thing that really impacts parents' decisions of whether or not they're going to vaccinate their child is just the opinion and the recommendation of their family and friends. So people really take those recommendations to heart. And if it's somebody that you look up to and respect, and they have made a decision to or not to vaccinate, that is something that patients really take to heart and consider strongly. And so I think that is where we come in. So, just like people who feel strongly about not vaccinating, often share that information wholeheartedly with everybody. I think it's important for those of us who feel strongly in vaccinating to also share that opinion with our family and friends, so that we can encourage them to get their vaccines, get their child and their family protected against these illnesses. This is just an explanation of really how safe are the vaccines. So keeping in mind, before it comes to the public, it is rigorously studied in the lab. It then goes through animal studies, making sure that it is safe and effective all along. It then goes to clinical trials, which is when there's first somewhere between 20 and 100 healthy patient human volunteers. If it's safe and effective there, then it's rolled out to thousands of patients as part of the clinical trial study. And so it has to be proven to be safe and effective throughout that before it finally gets rolled out to the public. Even after it is then being given to the public as a whole, that information continues to be studied and followed by the FDA. And so especially a vaccine like the MMR, which has been approved for decades, it has been studied for decades, and we know that it is safe and we know that it is effective. This infographic I like. This is another thing that I hear commonly in the office is, if a parent is hesitant about vaccines. Oh, well, when I was a kid, we were only vaccinated against, a few diseases, and now there's so many more. Like, why are there so many more? I don't want to put all of those things into my child. Well, the good news is that actually we protect your child against a lot more diseases, but we actually expose them to much fewer antigens. And so the antigen is like the piece of the virus that is presented to the body, and then the body's immune system learns how to recognize it, build antibodies that are then going to fight that off if you're ever exposed to the disease in the future. And so you can see here in the 1980s, you got protection from 7 diseases, but you were exposed to 15,000 antigens because they just weren't as good at making the antigens. So they had to expose your body to a lot more to actually mount that immune response. Whereas now, you're protected against 16 diseases. They only expose you to 173 antigens because they've just gotten so much better at making the antigens look just like the virus, so that your body's immune system recognizes it and then fights it off with only that minimal exposure. And then last but not least, this is a website that I really like. So it's ivaccinate.org. It has been put together by the Michigan Department of Health. I think it does a really nice job for families of kind of lining out the information, taking them through it in a way that's clear, it's easy to read. That's where this infographic, for example, came from. And they just do a nice job of walking parents through the information in an accurate manner so that patients have good information to make their decision. And that is all I have. So if there are any questions or concerns, we can certainly do that now. Yes.
I have a question on the first part. So do you know the accuracy of self-reported data in our area? Like, is there, because it all is self-reported, right?
Right. So I don't put a whole lot of stock. I mean, I think it's a good guesstimate, I think it's something to certainly consider, but it's nothing that I'm necessarily changing my practice over. Because and it was also, the way the data was reported, they answer questions about their own health and then the health of their household members. And obviously that's only based on 490 people who responded compared to the population as a whole. So I think it gives you a glimpse, but not overly accurate necessarily of the true needs of the community. Any other questions? All right, thank you.